Welcome to Tomorrow Makers, where we explore how we learn, live, work, and play now and in the future. I am Summer Beatty.
And I'm Carlos Ramos. Hi, Summer. How are you doing?
I'm good.
Welcome back, everybody.
Yeah, welcome. We have Elizabeth Legarsky with us today. She's a nursing instructor here at Penn College, and we also have her student, Kayla Kerstetter.
Wonderful conversation. Learned so much today about nursing, about what goes into nursing, what it takes to be the right kind of nurse, and really to know that there is not one nurse.
No, I mean, it was just really cool to hear Elizabeth's journey into nursing and Kayla's perspective on what it takes to just create that personalized approach to nursing. So it's not black and white. So that's what I took away from it. It's just nursing is not black and white. And I think this is a great conversation. I really think you're going to enjoy this one.
Yeah, a must listen to for anyone who's going through a nursing program right now, whether it's at Penn College or anywhere else. Just for anyone, life in general, I think there's some really good advice here to take away at the end.
Yeah, definitely.
So let's do this. Tomorrow Makers, enjoy.
All right. Welcome, everyone. How are we doing today?
Doing great on this Monday morning.
Awesome. Well, we're here today with Elizabeth Legarsky, also known to her fans as Nurse Lizzie, and student Kayla Kerstetter.
Good morning.
Good morning. So we're here to talk about nursing. So what drew you to nursing, and more specifically pediatrics? I think I read somewhere you weren't one of those young girls who grew up thinking, I always want to be a nurse. So how did you end up where you are today?
Yeah. So Summer, I never wanted to be a nurse. And if you told me in high school, this is where I'd be sitting, I would have laughed. I wasn't into science. I don't want to say I didn't take it seriously, but I guess I really didn't take it seriously. My background initially in high school, upon graduating, I went to art school for interior design. I love art. I've always been that person. I'm drawn to color and textures. And I thought I'd be at this point in my life living in a city and designing spaces and working for like a textile company. And I went to art school, and you have that idea in your mind of what life is going to be like. And I got there and it was nothing like what I thought it was going to be like. And I just felt very empty. And I remember thinking, this just isn't for me. And while art is a big part of my life and certainly a hobby, that's kind of where it stopped. So I was, like many college students, really lost. Like, where do I go next? I moved away from home. I moved out to Seattle for a while to try to find myself. Still couldn't find myself. I moved back home with my parents, and my mom's like, why don't you go to Penn College? I'm like, well, gee, I never thought of that. Okay. So I did. I enrolled in our former program as a physical fitness specialist, earning an associate degree and working out in the field. And at the very end of that program, I was fortunate enough to do an internship in cardiac rehab at our local hospital. And while the position was based upon exercise, I was working one-on-one with nurses and patients. And that is when I discovered, oh my goodness, I love this. I want to work with patients every day. And I want to be the nurse. I want to be right there, in the middle of care and being supportive and encouraging. And that is how I decided I wanted to go and become a nurse.
Oh, that's amazing.
Yeah.
So, and then peds.
Yeah. Love kids.
Yeah.
I tell students all the time. So, a lot of them, they love or hate peds. You're usually not down the middle. And obviously I'm one that loves peds. When I was in nursing school, so much of the care you provide in the clinical aspect, you are working with adult patients primarily. And the whole time I'd be out at the hospital, I'm like, well, this is okay. And I could do this, but I still just felt like a piece was missing to my puzzle. And it was, when I got into that pediatric rotation, I know that I've always loved kids, and you have to be that adaptable, flexible person that you're like the jack of all trades. So you're not just the nurse. You play with the kids, you color with the kids, you problem solve with the kids, you're working with their parents. And that is the type of person I am. And that just really drew me into working with kids. And I knew that while not everybody loves that, I did and I do. And I wanted to be that person, that bright spot in their day.
That's great. So you weren't afraid of change.
Oh, heck no.
And as you're describing it, it almost kind of feels like a little artistic. There's there's the art side of care too.
Absolutely.
Just going with the flow. It's not fixed.
No, never in peds.
No, 2 days are the same.
Exactly.
Yeah. So Kayla, you worked in peds as well. You said you have
So I had my clinical rotation in peds.
Okay.
Actually last semester. So Mrs. Legarski, as I know her as a student, was our clinical instructor for that rotation. So I got to work with her on the peds floor and kind of get just a little bit of a feel. I don't think we get enough time in the pediatric side, but I also fell in love with it. So I could spend every day there and it wouldn't be enough time.
Oh, that's great. And you have rotations, right? So you get to expose to all different areas with clinical?
So we saw 2 different floors. One's kind of the younger kid side and the more adolescent side. And then we also were able to have one day into one of the more specialties. So like the NICU or the pediatric ICU. So we got just a glimpse of what that looked like.
Nice. Yeah. So I imagine that's helpful as nurses decide, where do I want to go from here? So that wasn't split down the middle for you then either. You knew you were on the love side of the love-hate. Yeah.
Yeah. It's interesting to see my classmates kind of fall one way or the other. Some of them went into it not knowing whether they'd like it at all. We have a classmate who is older, non-traditional student, never had any kids of his own. And I was fortunate enough to see him first day just kind of swoop in and care for just a little girl. And it was like this instant connection. And he was so wonderful with her. So it was really cool to see that.
That's great. Yeah. Okay. So, and then you ended up here at Penn College, back to Penn College as an instructor.
That was always on my bucket list. I have a really big bucket list. So, and I think that's the cool thing, that we're always evolving and changing. Nobody's stagnant. But yeah, I was here as a student. So once as the physical fitness specialist student and then as a nursing student. And while getting ready to graduate nursing school, I felt very much that being an educator would someday be in my future. And I set my eyes on that goal to get back here someday and teach where I went. I believe in our program. I believe in our students, and being out at the hospitals and working with so many different students in the areas, you can really, how we stand out among some of the other local programs. And I wanted to be a part of that success story. Absolutely.
Yeah, that's really cool. So what's it like? Have you gone back to a floor where you've worked before as an educator supervising students in a clinical setting?
Yeah, so I get to go every semester to my old stomping ground in pediatrics, and it's an interesting experience when you're wearing a different set of shoes in that role. But it's also great when you get to work with some of your former colleagues and you still get to see their part of success being hands-on at the bedside. And I love being able to partner some of the students with those really strong nurses that helped me become who I was and shared their skill set with me. So I think it's just a really fun position to be in because I get to see the best of both sides.
Yeah. Do you have any students that are then in the, I'm trying to think of how long you've been in this position. Like, do you have students that are then in the field that say, hey,
I do.
This is why I'm so happy this is happening, or this is really cool.
Yeah. So I do see them, not tons of students, but just this semester, there's somebody that I had a couple semesters back that has now graduated and has taken a position in peds. And she's like, look, here I am. And I'm like, I love it. Like, I love that for you. And then it's always great to be able to pair students then with that former student who understands what a current student is going through and what they need to focus on at clinical. And they can kind of share that camaraderie of, I've been there. I know what it feels like. You can do it. And I think it's just a fun process to watch unfold.
I really like when they pull us aside as students and they're like, hey, I didn't get to see this in nursing school. Come take a look. Or do you want to see this, and really involve us in the patient's care, whether or not we're assigned to that nurse, they still reach out to see, do you want to be a part of this?
Nice. Yeah, it's all part of the hands-on experience, right?
Oh, yeah. And there's a lot that we see in textbooks, but we don't see in patients. So when that patient comes in, it's kind of like that, I want to see everything.
Mm-hmm.
So it's nice to have that opportunity.
Yeah, and you're prepared next time around. It's not new.
Well, you're at least not quite so scared to kind of
Yes.
tackle it.
This is true. Yeah.
Now, you noted that you wanted to be part of the program on the education side, and that there was that our program is different in ways from other programs. What do you see as being different? I'll turn that to you, Lizzie, and then Kayla. I don't know if you've had exposure to peers from other programs that you might have some insight on that as well.
Sure. So I would say the thing that truly sets us out above other programs is the hands-on aspect. So while all schools go to clinical and all students have, clinical experiences, our students have an incredible amount of time at the bedside, and we don't wait. You were out there like week 2. As a brand new nursing student, your hands are in the pot. And I think that's so important, because when you're teaching somebody how to be a nurse, it is all about the patient and the patient care. And like Kayla mentioned, there's only so much you can learn from a textbook. You have to be able to see things with your eyes, feel things with your hands, do things. And our students are out there doing that. And I just think that goes such a long way in the success that they have as a future nurse, and making those connections in the community with other professionals. And I know that our students do stand out among the healthcare systems, and they're very eager to hire our students. So it speaks volumes to the programs that we have.
Yeah. So on my end, I've had a few coworkers, because I actually work as a patient care tech for Geisinger. So that kind of gives me a little bit of a different side to nursing. I mean, it all interconnects, but I've had coworkers who are in nursing programs, and they spend a whole year in like the kind of the school aspect of learning disease processes and some of the hands-on stuff of caring for patients, but it's not until their second semester that they're even introducing themselves to an actual patient. Whereas it was, I want to say, maybe week 3 or 4 of my very first semester, we're out in clinical. We're not doing quite a lot, because there's still a lot we're learning in patient skills and things like that. But we are able to start to develop our nursing style, because everybody approaches it differently. So it's nice to interact with patients, and everyone I've worked with thus far has been so understanding of, hey, I'm a student, there's a lot I don't know, and they're that helping piece, and they really enjoy that. So it's nice to have this all before it's on my license. So I'm a big person for, I want to see everything and anything, just because if I run into this as a brand new nurse, I'm probably going to be that person stuck on the wall, because I'm kind of in a fear mode. So I'm able to kind of hit that early on to get more comfortable in my shoes as a nurse.
And having that experience, did that reinforce, yes, this is the right path for me? I'm assuming you're sitting here as a nursing student. It did.
Yeah.
But that's a huge benefit. I mean, can you imagine being in a program for a whole year and then going into clinical and being so scared and just put off by it?
Oh, yeah.
I don't want to do this. I just wasted this year, I mean, so I think that's a huge benefit too. It's engaging for the students, but it's also helpful from a career perspective.
Oh, and it definitely has helped kind of knock out areas that I do and don't like. I went into nursing school not knowing what kind of nurse I wanted to be. I wanted to be very open-minded. I had interests because there's so many different aspects of nursing, whether you're a floor nurse in a specialty, there's school nursing, there's just so much. And being able to take that in from the get-go was very nice and very helpful.
And Kayla, what is your intended licensure when you graduate? What are you looking to achieve?
So upon graduation, my ultimate goal is to go for my RN.
Okay.
And then hopefully with time, kind of further that to the BSN. I'm in the 2-year program, so I'm eligible to sit for the NCLEX as an RN.
Okay. And so for our listeners, Nurse Lizzie, it might be helpful to explain the difference between what a student might do to get their RN licensure versus BSN and MSN.
So here at Penn College, we have a lot of different tracks, and that's really helpful because people are coming in at different parts of their life, whether you're the traditional student or maybe this is your second career, maybe you were lost like me. There's a place for everybody. So we do have the 2-year associate degree nursing programs that will allow you to sit for the registered nurse exam, just like Kayla mentioned. You can do that on it's a full year, 2-year program, full-time. Or we also now offer that part-time option for people that do need to go out and work. Now, granted, it's going to take longer than 2 years, but you're able to make that work with the position you're in at the moment with your life. And those students too will be eligible to sit for their registered nurse exam for state boards. We have a traditional bachelor's program for those students who are coming in, fresh out of high school. They know that they want to go into a bachelor's program. We have a bachelor's completion program. So that's, if you were like me, I went through the 2-year associate degree program and then worked for a while and then decided to go back. That's an option too, where you start taking classes on a full-time, part-time basis. We also have, our LPN to RN program. So those are working licensed practical nurses who are coming in and going through the associate degree RN program. And now our newest feat is the Masters of Nursing Education we have online. So there's just so many options and so many ways to meet your goal.
Wow. Yeah, for sure. It sounds like it. I want to talk about Nurse Lizzie and the YouTube channel, if that's okay.
Yeah.
So I think we might have a handful of faculty members with the YouTube channel, but not too many. So we were excited to talk to you about that and how that all originated.
Sure. It's been a work of love for quite a few years, to be honest. It was just a matter of working up the nerve to kind of jump all in. It's something that my husband and I have talked about for the last 3.5 years. I realized when I was a new grad, as excited as you are to become a nurse, it's really scary. I went right into a pediatric intensive care unit as a new grad. There's so much that you don't know. And so much of your learning happens on the job. You learn what you need to learn in school and to pass boards, but then there's the next phase. And when I was a new grad, YouTube was just getting started. There were not all these wonderful educational outlets and different forms of social media to better understand concepts. And as time went by and YouTube became a bigger thing and Instagram and all the things, I noticed that while there's lots of nursing avenues, there's not a whole lot in pediatrics. And I know how helpful I would have found that as a brand new nurse, just trying to freshen up on ideas that or content areas that I learned in school. Because you're working 12-hour shifts, you're busy, but you could see something one time and you don't see it again for 6 months, and you just need a quick reference aside from a textbook. So that coupled with seeing some students really struggle in a specialty that they have that love or hate relationship with, I'm like, well, why can't I fill in that gap? Why don't I share some of that that knowledge that I have over the past 11 years in the field with people, whether it's students or new grads or nurses that maybe they've worked for 20 years with adult patients and now they're coming into peds, where you're like, oh gosh, it's been years since I took care of a kid. I don't remember, or I know I learned it in school. I don't remember. So that's really where that idea of Nurse Lizzie came from. Not to say my goal is to help anybody in their walk of nursing, whether it's a student, a new grad, or a seasoned nurse. But I definitely see that we have a need to foster some additional help in pediatric nursing per se.
Nice. So what does that look like in practice? Your site, I know you have a couple videos on there. You just launched it, right?
Yes.
It's pretty fresh.
We're in the infancy stages. So right now, I do have a couple YouTube educational related videos, as well as some I call it more like lifestyle videos. Just being honest about, things I take to work in my nursing bag. How would you ace a nursing interview? So it's in its very young stages right now. But what I'm hoping to do and to grow with time is certainly to be able to offer one-on-one tutoring sessions that are tailored to a unique student's or new nurse's needs. Potentially being like a guest lecturer in a facility, being a guest speaker, doing some podcast activities down the road, just like this one. This is great.
Good practice.
Knock that right off my bucket list. All things that I see, and providing, for example, like digital study guides for students that I know helped me, or things that I know that I utilize to help my students that I can allow, other people to use.
When I know another thing that I kind of pulled from the couple videos I watched was that it was just able to kind of give you a further look at what pediatric nursing is. Because I think there is a stereotype into peds nursing. It's like, oh, you're just taking care of babies, and oh, your job must be so much fun or so easy. And your shift does not look like that necessarily. So it's nice to kind of squash that stereotype and to see, like, yes, there are definitely some fun aspects to it, but not every day is cookie cutter like some people may assume.
So true.
Yeah, I love that your students are seeing the channel and able to get some good info from it. You're getting, I'm assuming, some great feedback, just like Kayla shared?
I mean, so far it's been great. It's interesting. Like what, some people are like, I just found you on YouTube. And that's always a fun conversation. You're like, oh, really? Great. Thanks for watching. I hope you subscribe so you never miss something. But Kayla's class in particular, a lot of the students in her cohort, they were like, why don't you share some of your insight with other students, or students that don't just go here? And I'm like, I'm working on it, and it really did help motivate me to just jump all in.
So how do you come up with your topics? I'm sure you have hundreds in a notebook in your purse somewhere written down that you just need to take the time to record.
I do. So I'm the queen of Post-its. There are so many Post-its at our house of ideas that, just lots of things I have coming down the pipeline. But I try to just look at the overall curriculum of what I'm teaching students on a regular basis and what they need to know to pass boards. And then kind of coupling that with what did I struggle with as a student? And then what did I struggle with as a new grad? Or what kind of gaps, things that people they need to talk through it with somebody. I kind of think of myself as like the big sister to some of the learners that are out there, because I know I felt like I needed that as a student. I just needed that little bit of support, and I didn't always know where to turn to find that. So that's kind of helped me to narrow down some of the areas I want to focus on.
Great. So I'm just thinking through the community aspect, and so YouTube, the videos are up there and people can comment on them. Is there a plan to move into some type of community where there can be an exchange of ideas between nurses, both students and practicing nurses?
So one of the things that we have kind of planned for the future, it's nursing in the spotlight. And what I would love to do is collaborate with different specialties in nursing around our local community and pull in some of the grads that have gone through our program to see where they're at now, and host, more of like a live type of session where students can ask their questions in real time and get an answer, get feedback, be part of the conversation, and hear from some of our nurses in the community. What are you doing now? What does a day look like to you? And really just, I think the sky's the limit with that one. There's so many avenues that we could explore and pulling in people in the community.
Yeah, sure. And I can't help but think about the nursing shortage and the need for community and the need for support to just continue to elevate the really important role that you all have in the community and serving patients.
Absolutely. I know, I hope I'm speaking this quote correctly. The American Nurses Association, it's about 18% of new grads leave the profession within the first year. And you compound that with our already existing nursing shortage. I think it's so important to have support systems in place you've worked so hard as a student to get through nursing school, to sit and take boards and be the nurse. We don't want you to walk away. Like, the world needs nurses for sure. Patients need you. So I think it's important to look at ways we can build up a community of support, no matter what stage of nursing you're in.
Is it the stressors of the shortage that we already have that's causing these new grads to leave at a rate of 1 in 5? That's crazy.
So it's a couple things. You have new grads training new grads, and we've lost so many of our seasoned nurses that were such a rock solid support on the floor, and burnout and staffing shortages, and the patient acuity is much higher. It's all of those things coupled together. But the one thing that we can really look at is what kind of support and what kind of training are we offering new grads, and how do we keep them there? We've worked so hard to get them. So how do we keep them in place? And I think that's plays such a huge role in that turnover in that first year of the profession, is what did your orientation or your preceptorship look like? And did you feel like you had somebody to go to help you through those tough times and tough moments? And I think that's where nursing in general, we need to really focus our attention on, to retaining those new grads.
And I think COVID played a big role in the loss of nurses. There was a lot of students who, because of COVID, didn't get to have that hands-on experience. So they had all textbook. So when they got onto the floor, it was nothing like they expected. And I think that was just such a struggle for people that they left bedside nursing and they went into other roles just because there are so many. And that just really kind of put a hindrance on everything.
So do you want to pivot to, I have to bring up the physical fitness background, because I think somewhere I read that you consider yourself a holistic nurse. So how does that background in physical fitness play into your approach to nursing and educating young nurses?
Great question. So I think when you look at your physical health is just one small piece of the pie when you're looking at your patient. And there's so many other aspects, your spiritual, your emotional, your social, psychological well-being, all of those things. And when we're out taking care of patients, they come in with a diagnosis of XYZ. It's a problem that we have to fix. But 9 times out of 10, coupled with that actual medical surgical problem, there's an emotional problem, there's a psychological problem. And that's all aspects of nursing. It's not just adults, that's peds too, or the family dynamics that we're looking at. And I think that we can fix a physical problem, and that's great, but we have to fix the other components as well. So, looking at the bigger picture, you have to be able to be one of those nurses that you see the forest through the trees. How can I best help them? What other support systems can we get in place? And sometimes nurses are the first people that we recognize, hey, we need to get social work involved, or we need to get a psychologist in here to talk with this patient. That might be the first time where we've been able to intervene for them. So I think that, while everybody has their own style and their art of nursing, you have to be able to look at that whole person that you're caring for, to truly provide for their needs. And that's my approach, just looking at the big picture.
Yeah, do you think that's common?
Not anymore. I think that because of our nursing shortage, a lot of the care that is provided has become very task-oriented, where it's just like checking off a box. Yep, I bathed my patient today. Yep, I turned my patient. Did you sit and talk with your patient? Do you know anything about them? And granted, we're very fortunate in peds with our nursing, our staffing ratio and our patient ratio it's very small. So you do have time to sit and color with a kid or paint their nails or do their hair, find out about their life story, play Legos. And sometimes you're the one that they'll open up to. But for me, success is, when I look at how did I provide care for a patient today, did I check a box or did I genuinely bond with that patient and provide for their needs?
Yeah, and I think that's huge too, to develop that relationship. I always tell patients, when they're being discharged now. Like, it was great to work with you, great to see you, but I don't want to see you again, because that means they're back in the hospital. I'll tell them, I'm like, oh, it's great. I'll see you out for coffee or at like the grocery store. Like, I love that. Like, I want you to be in a place that you don't need to be in a hospital. But I still like to develop that kind of relationship where that doesn't come off, like it comes off as more of like a joke and they kind of get a laugh out of it. You see these people sometimes at their very worst. So to see them go from one end of the spectrum to the other in terms of how they're feeling or their general health is really, I can't think of the word right now, but it's just really nice to see.
It's rewarding.
Yeah.
Yeah. And that's a word we use a lot when we talk about nursing, because it is a rewarding career.
Absolutely.
So I am curious, Kayla. You talked about building that relationship with the patient. Are you seeing patients more at the acute end, or are you seeing like patients that are coming in with chronic issues?
It's a little bit of both. You do get the chronic kiddos that you'll see their name pop up on the board to be placed into a bed, and you're like, oh, I know, like so-and-so is back in, and you already kind of have an idea of maybe what brought them back in, if it's an exacerbation of symptoms, or there's a little kiddo who's coming in for something acute, whether it's they had their tonsils removed and they're in for an overnight stay. But you want to look at treating either patient the same. Obviously, you're going to have more of a relationship with a chronic kiddo because you've seen them a couple times, but you still want to develop that kind of style of a relationship with somebody who's coming in for a night. It makes caring for the patient a lot easier in the aspect of they're more willing to work with you. The parents are willing to work with you. And I think the parents are the hardest part of pediatrics, not necessarily the diagnosis of the kiddos, because a lot of these parents are scared. They don't know what's wrong with their kid and they want them to get better. And it's hard to kind of delineate, like, yes, I'm caring for the kiddo in the bed, but I also have to remember to take the parent into consideration as well.
Because that's part of that holistic treatment, right?
Absolutely. The whole family unit, the whole patient themselves. Yeah, that's great.
Is there anything that's happened, I guess, in either of your cases where you've been in a really interesting and rewarding, I'll use that word again, situation with a patient, or Nurse Lizzie, in your case, with a student that, has sort of validated, okay, I am doing the right thing. This is really amazing.
I can say both in taking care of kids and taking care of my students. Absolutely. So I spent 8 years in pediatric oncology. So I'm seeing kids with some really difficult diagnoses. And sometimes what you see in the chart, you're like, they're never going to live through this. All the odds are against them, but you keep that open mind and you're part of their care and you're part of their story. And to see them walk out the door is it's just the best moment. I can't even put it into words when they go on and they live a beautiful life and they are A-okay and they make it on through. And you know that you were a little piece of that's just awesome. As far as students, I love all my students, but I enjoy working with those that maybe struggle a little bit or need that extra push, because I know that I did at one time as a student. And if it wasn't for the people that took the time to meet with me one-on-one and help me understand difficult concepts or encouraged me, after I had a difficult test or I didn't do so great, I might not be here today. So, whatever I can do to help in somebody's journey, that's why I'm here.
I think my biggest thing thus far has just been kind of pulling all my concepts together in patients to see their diagnosis and realize, oh, hey, I learned that in med-surg or whatever course I'm in at the moment, and I'm able to tie it all back together. For me, that's really rewarding, just because I'm like, oh, hey, look, I'm actually learning this.
Right. The process worked out.
Yeah, exactly. Yeah. So it's nice to have that in the back of my mind.
Good.
So, Lizzie, you have a strong mentor role with these students that you're working with. Who was your mentor, or who have been your mentors, and what have they meant to you?
I have a couple. So, first and foremost, my husband's my biggest mentor because he is incredibly talented and creative, and he's my go-to. He's the jack of all trades, but I can throw all of my ideas at him and I want to do this in 10 years. I want to do this in 5 years. Can we do this, Chris? And he's always got a plan. He's the planner. So plays a huge role, and he's done so much behind the scenes for Nurse Lizzie. It wouldn't be a thing if Chris wasn't part of that story, for sure. And as far as being a nurse and getting to the educator role, there's definitely faculty here that I had as a student that played a huge role in encouraging me and making sure I didn't give up when I wanted to throw in the towel. And just seeing their approach with students inspired me to take on that educator role and be like them. I mean, they were a huge part of my story. So I definitely wouldn't be sitting here if I didn't have that strong faculty cheerleader when I was going through the program. So that's kind of my hope, that I was a cheerleader. So I'll always be a little bit of a cheerleader. Like, I want you to succeed. So absolutely.
And Kayla, where do you find that inspiration to do what you're doing as a student and future nurse?
So that actually came a lot from working in my current role, seeing the nurses on the floor. I've gotten a lot of, this is the nurse I want to be, and a lot of, this is the nurse I don't want to be, because you do see that still. That was what drew me back into nursing. I'm a non-traditional student. So that played a big role in even coming back to school, because that was a big feat to cross. But once I got into kind of being a full-time student again, which is a crazy thought to me, I already have a degree in exercise science, formerly physical fitness specialist. So I had a different kind of career in mind. Nursing was not it. So I have drawn a lot from my personal experience, and then coming to campus and seeing the totally different nurses that we have, because a lot of them were floor nurses 20 years ago. They haven't been a bedside nurse in a number of years. So it's their teaching styles that kind of help kind of form who I want to be, as well as like my clinical instructors, who are just a wealth of knowledge. I've not had a clinical instructor that I haven't liked. So that's been really helpful in kind of tying it all together to kind of form who I want to be. So I'm a little bit of everybody in a sense. I'm a good mix.
Yeah, I love this. I never thought about nursing in a such a personalized way of, and Kayla keeps saying the nurse I want to be. I think that's really, really cool. I've always expected, there are terms, there are textbooks, there are skills you need to master, and then you deliver those skills. And then we all have personalities, but I love that. That's just something I never considered.
And it's interesting to see, even just in my cohort of, I think there were 22 students, to see how different of nurses we are from one to the next. We've all kind of developed our own little style and kind of in the way we want to be a nurse, and the style of nursing and the field of nursing. There's no two students alike, which is interesting to kind of see where we drew to what brought us and where we're going. It was just something that I didn't expect.
Right. And it pulls in the emphasis on our instructors and how important you all are as role models and as mentors. So we're very lucky to have Nurse Lizzie on board here, educating our students.
Thank you.
Yeah.
Thank you for that. I'm very delighted to be here.
If there's one thing you'd like the listeners to take away from this conversation, what would that be?
Dream big. Nobody has to fit inside a box. Life's too short to fit inside a box. And you can do all the things, and you can have the bucket list that's really, really long. I know I do. But I think that just dream really big and never stop growing, because you just don't know what the next chapter is going to look like. And I know when I was a student, I'll never be able to do this, and that. And I've crossed it off the bucket list. So dream really big.
I think the big thing is it's never too late. I never thought I'd be the non-traditional student to come back to school again. So to have that ability and to be able to not only do it, but to conquer it is really nice. To know that there's light at the end of the tunnel.
Thank you for that. Those are great. I don't know how we can do any better. I mean, I feel like we left on such a high note. So, yeah. Thanks so much for being with us.
Thank you so much for having me.
Absolutely.
Yes, thank you.
Thanks for hanging out with us today.
Don't forget to rate, review, and subscribe wherever you listen to your podcasts.
Check out our show notes for bookmarks to your favorite sections and links to resources that we mentioned in today's episode.
You can also find past episodes and see what's on deck for upcoming ones at pct.edu/podcast.
And of course, we are open to your thoughts, ideas, and suggestions. So send those over at podcast@pct.edu.
It's been real.
Catch you next time.